Gut health is essential for your overall well-being, yet many people overlook the health of their digestive system. Gut health is essential for your overall well-being, yet many people overlook the health of their digestive system. In this video, WA Health and Care, with insights from Dr. Megan Rossi, UK, and Dr. Mark Hyman, USA, explains how to maintain a balanced gut naturally and protect your digestive system. What is gut health? Understanding your digestive system. Gut health refers to the overall condition and performance of your digestive system, which includes your stomach, intestines, and the billions of bacteria that live inside them, known as your gut microbiome. When your gut health is strong, your digestive system can properly break down food, absorb nutrients, and protect you from harmful infections. According to Dr. Megan Rossi, a UK-based gut health specialist and researcher at King's College London, maintaining a balanced gut is vital for your digestion, immune system, and mental well-being. She explains that the gut is like the body's control center for overall health, often called the second brain, because it communicates directly with your nervous system. When your digestive system is healthy, you experience regular bowel movements, less bloating, higher energy, and better mood. But when your gut health becomes unbalanced due to poor diet, stress, or antibiotics, the harmful bacteria can outnumber the good ones. This leads to indigestion, constipation, fatigue, and even mood changes. Recent research from both the UK National Health Service, NHS, and the American Gastroenterological Association confirms that a healthy digestive system supports heart health, brain function, and immunity. A poor gut, on the other hand, increases the risk of diseases like irritable bowel syndrome, IBS, diabetes, and autoimmune disorders. WA Health and Care, with expert insights from Dr. Megan Rossi, encourages everyone to care for their gut by eating fiber-rich foods, staying hydrated, and managing stress daily. A happy gut means a healthy life, because your digestive system truly affects every part of your body. What are the causes of poor gut health? Poor gut health develops gradually and is often linked to our daily habits, diet, and lifestyle choices. According to Dr. Megan Rossi, gut health specialist and researcher at King's College London, your digestive system can lose balance when harmful bacteria grow faster than the beneficial ones, disrupting your body's natural rhythm. One of the leading causes is an unhealthy diet, especially one high in processed foods, sugars, fried items, and low in fiber. These foods feed the bad bacteria in your digestive system and reduce the growth of healthy microbes. Over time, this imbalance leads to poor digestion, bloating, constipation, and inflammation. Another common cause is stress. The gut and brain are closely connected through the gut-brain axis, meaning emotional stress can directly affect digestion. Prolonged anxiety or tension can slow down your digestive system, cause irregular bowel movements, and weaken your immune response. Lack of sleep and sedentary lifestyle also damage gut health. Studies from the American Gastroenterological Association reveal that insufficient rest and limited movement reduce gut bacteria diversity, which weakens digestion and overall wellness. Antibiotics and certain medications can also disturb your digestive system's natural balance. While antibiotics fight infections, they can also destroy the good bacteria needed for a healthy gut. Lastly, dehydration is often overlooked. Without enough water, your digestive system cannot process nutrients or eliminate waste efficiently, leading to sluggish digestion and discomfort. In short, your gut health depends on consistent care, nutritious eating, staying hydrated, sleeping well, and managing stress. WA Health and Care, guided by insights from Dr. Megan Rossi, reminds everyone that small daily habits can either heal or harm your digestive system. What are the symptoms of poor gut health? When your gut health or digestive system becomes unbalanced, your body begins to show early warning signs that shouldn't be ignored. According to Dr. Megan Rossi, a gut health expert from King's College London, most people overlook these symptoms, assuming they're normal, but they can reveal deeper digestive problems. One of the most common symptoms of poor gut health is bloating and gas. When the balance between good and bad bacteria is disturbed, your digestive system struggles to break down food properly, leading to discomfort and a swollen stomach. Persistent constipation or diarrhea also signals that your gut bacteria are out of balance. Fatigue and low energy are another major sign. A weak digestive system fails to absorb essential nutrients, leaving you tired even after a full night's sleep. Research from the American Gastroenterological Association shows that gut issues can directly affect your brain, often causing mood swings, anxiety, or depression. Skin problems like acne, eczema, or dullness may also result from poor gut health, as toxins that should be removed through digestion instead circulate in your body. Similarly, a weakened immune system, frequent colds or infections, often points to poor gut bacteria diversity. Some people experience food sensitivities, reacting strongly to dairy, gluten, or processed foods. This happens when an inflamed digestive system struggles to handle certain ingredients. If you often feel bloated, tired, or irritated after eating, it's time to listen to your body. Your gut health plays a vital role not only in digestion but also in how you think, feel, and function every day. WA Health and Care, guided by insights from Dr. Megan Rossi, encourages everyone to take gut symptoms seriously and make lifestyle changes before they turn into long-term digestive issues. What are the treatment and natural remedies for gut health? Improving your gut health and supporting your digestive system doesn't always require heavy medication. It often starts with small, consistent lifestyle changes. According to Dr. Megan Rossi, UK, and Dr. Mark Hyman, USA, healing the gut naturally can improve digestion, mood, and immunity within weeks if managed properly. The first and most effective treatment is a gut-friendly diet. Eat foods rich in fiber, such as oats, apples, leafy greens, lentils, and beans. Include fermented foods like yogurt, kefir, sauerkraut, and kimchi. These are packed with probiotics that help restore healthy bacteria in your digestive system. Avoid processed foods, refined sugar, and soft drinks, which disturb gut balance. Hydration plays a major role too. Drinking plenty of water helps your digestive system process food efficiently and remove toxins. Herbal teas such as peppermint or ginger tea also help relieve bloating and support digestion. Exercise is another natural medicine for gut health. Regular movement, like yoga, walking, or light cardio, helps stimulate digestion, reduce constipation, and lower stress, which directly benefits your gut-brain connection. Some people may need probiotic or prebiotic supplements, which can be recommended by doctors. Dr. Mark Hyman suggests choosing supplements that contain multiple bacterial strains to support a diverse gut microbiome. For mild gut discomfort, natural remedies like aloe vera juice, apple cider vinegar, or digestive enzyme tablets, as advised by a healthcare professional, can be helpful. WA Health and Care encourages everyone to care for their gut health daily, eat clean, stay hydrated, manage stress, and move often. A balanced digestive system means more energy, a stronger immune system, and better overall health. What are the precautions for gut health? Taking simple precautions can help you maintain a strong digestive system and balanced gut health for years. According to Dr. Megan Rossi, UK, and Dr. Mark Hyman, USA, prevention is the most effective form of treatment when it comes to your gut. The first precaution is to eat a balanced diet rich in fiber, fruits, vegetables, and whole grains. Avoid overconsumption of fast food, sugar, and processed snacks, as they destroy healthy gut bacteria. Instead, focus on probiotic-rich foods like yogurt or kefir that naturally support digestion. Secondly, stay hydrated. Water helps the digestive system break down food efficiently and flush out harmful toxins. Dehydration often leads to constipation and poor nutrient absorption. Manage stress carefully. Stress directly affects your gut-brain connection, leading to issues like bloating, acid reflux, and fatigue. Meditation, yoga, or even short daily walks can reduce stress and improve gut balance. Avoid unnecessary antibiotics or painkillers, as these can disrupt the healthy bacteria in your intestines. Only take prescribed medicines under medical supervision. Lastly, maintain regular exercise and proper sleep. Movement keeps your digestive system active, while quality rest allows your body to repair and balance gut bacteria. WA Health and Care recommends these daily habits to protect your gut health naturally and avoid long-term digestive problems. Remember, a healthy gut means a healthier, happier you. Thank you for watching WA Health and Care. Remember, your digestive system and gut health are vital for energy, immunity, and mood. Small daily habits like hydration, proper diet, and exercise can make a huge difference. What gut health topic should we cover next to help you feel your best?